All right. We're doing a little rehearsing during the commercial break, which, by the way, was a quick one. I barely got a sip of water in me. All right. So another couple, I believe it was a man who asked this question. He says, all right, I've been with Dr. So-and-so. Dr. B was the actual doctor, but no last names. Dr. B, what if I don't like the Internet and I don't know how to go on to the Internet and check to see? You call your physician. Just simply call the physician and say, are you a participating doctor with Cigna? Now, the mayor said 97% of physicians. I believe you said 90% at the opening of your seminar. So it's not an exact number. We don't want to hold our feet to a fire. But let's have Peter explain to you what the process will be if there's any conflict with your physician. They have already thought of that. Go ahead.
Yeah, we're very concerned with the fact that some physicians are not in the network. I believe the number is the network match is somewhere around 93% or 92%.
Perfect.
And we understand that is a problem. So if you go on the network and find that your doctor is not there. And by the way, if you're not comfortable going on a computer, you can call your doctor. If you're not comfortable calling your doctor, you can certainly call into Maureen at the mayor's office at 203-574-6712. And she'll have a computer and she can go on the network and work through it with you to the extent you're willing to divulge that information to her. And if you're not willing to do that, then come in on Tuesdays between 9 and 11, and Cigna will be there with laptops, and they will walk you through the network to determine if your doctor's in there. If you are in the minority, the small minority that finds that your doctor is not in the network, there is a process through Cigna and Delta Dental to fill out a form and give it to Cigna and Delta Dental. They will then approach your physician and try to negotiate them into the network. We believe it's in the interest of the physicians to be in the network, given the fact that the City of Waterbury has numerous retirees that are participating in the Cigna plan in the Waterbury area. So we think it's in their interest to do that. Cigna believes that, too, and they're going to make every effort to get your physician into the network.
Right. I felt that they were well represented today. They didn't just hide. They were out there in the face. They did make a concerted effort to take every question. Sometimes I go to a seminar and people are looking at their watches, and then the speakers will just say, okay, Mayor stayed there past 12:15, addressing every question. We clapped at the end because it was nice to see a large amount of city people together. And they all, I heard some Italian speakers in the hallway outside. It was good for them to get out and on a beautiful spring day and see each other. It didn't seem, which made me happy, that there was a lot of negativity. So if it's okay, we are going to take this call. I don't like a lot of axe grinding on my show. So if you are just here on the airwaves, which is your freedom of speech, try to be a little more positive on a spin. This is addressing the city change. If you are a retiree of the city, we'd be more than happy to take your call. If it's just going to get long-winded, I might unfortunately have to cut you off because sometimes it gets a little too political, and that's Larry Rifkin's gig. Caller on line 1. Thank you for patiently waiting.
Hey, Mike, happy Easter to you.
How are you, buddy? I knew it was you by the voice. How you doing, sir?
Doing okay. Happy Easter to you and your gang.
Happy Easter.
Hey, Mike, I'm constantly having on here 3 radio stations, 2 TV stations.
I know it.
Computers. And I'm looking at the chatter today, and I wonder what the effect might be on the city contract with Cigna. We're seeing, day by day, we're seeing further effects and the exact regulations on this Obamacare as they're rolling out, and it appears to be a devastating contract, a devastating law that will probably create mass confusion in the healthcare and the healthcare insurance industry. That's what I'm getting today from the biggest guy on radio. I don't have to name him, but everybody knows who the king of that is, and he's saying that this is just going to be mass hysteria. Is that possible?
Absolutely. The exchange is being rolled out for January 1st, 2014. But Peter and I are here to say that this plan is a retired, grandfathered-in plan. Peter, do you know? Because the answer is no, I don't know. Is this health care reform affected, or is it a grandfathered-in plan?
We are impacted by the Health Care Reform Act. I'll give you an example how we've been impacted.
Good question, Ferris.
We had a hard $1,000 cap on our prescription drugs for our POS and our POE plans, which meant that once a participant hit the $1,000 max, they were out of pocket from that point on. Under Obamacare, you cannot have a hard cap in your plans, so we had to take the hard cap off. So as it stands now, we have unlimited drug on the POE, and on the POS, when you hit the $1,000 cap, you roll over into the out-of-network payment structure.
Really?
Yeah.
And the PPO?
The PPO already had that, so we didn't have a hard. We did not have a hard cap on the PPO. The other thing is that we're going to be significantly impacted by the various taxes and fees that the Obamacare is going to impose, and I'll give you an example. I can't list them all, but I do know in 2 years there's something what they're calling the Cadillac tax.
Correct.
And currently the Cadillac tax would impact the city on our PPO because that falls in the classification of the Cadillac plan. I believe currently if we were to apply that tax, that would cost us somewhere around $750,000 a year.
Holy cow. Ferris, you got your answer, huh?
Well, I do, and I would ask a follow-up, and that is putting the city contract aside for a moment.
Okay. In general, which I can handle. In
general, for the benefit of everybody who's listening, regardless of where they're employed or who their carrier is or their retirement status. I'm just hearing pretty credible sources saying that this cannot work and will just simply create hysteria and mass confusion in the healthcare business, which is the most important to most people because you can't separate your health care from your own welfare.
Right.
And I don't mean that in the government sense of welfare. I just mean that, your life is dependent upon your health care. And what can be done, if anything, to keep this abomination from coming into law?
It's done. Judge Roberts signed it. It's done. It cannot be repealed. The one thing I can say, and I always talk in generals, you will be taxed $2,000 after January 1st, 2014. If you don't buy insurance from me, hopefully you will. And I'm going to a chamber-sponsored program with Carmody and Torrance, the great law firm that always calls in on this show. They are giving a health care reform with Jason Madrick seminar tomorrow at the Harold Cancer Lever Center. And the details that are coming out are $2,000 fine per individual, $3,000 fine per employer. Those are set in stone. It may change within a couple dollars. You might get a $2,500 fine. But just in general right now, it looks, if you don't purchase by a deadline of the end of 2013, credible insurance coverage, whether it be platinum, gold, silver, bronze, you will get the Cadillac tax, which Peter so eloquently put. It is actually called the Cadillac tax. And if you're an employer, it was supposed to be March, but March is over within a brief couple days. So that's been pushed back to sometime this summer. As an employer, and Peter, I'll make sure I stay on top of this one for you, even though you're probably more brilliant than I am. The city must inform their employees, and every one of my groups that I insure out there must inform by the deadline that the government sets that there is an exchange out there and there will be a subsidy on the exchange. Now, the word, Ferris, which you and I both agree, Patient Protection Affordable Care Act. Where's the word affordable coming out of all this? Keep your kids on your plan till age 26. Encourage them not to go get a job. It's just, with all the healthcare changes, the only one I do like, which I'm not a fan of a lot of it, but the only one I do like for a gentleman who's lost his mother to breast cancer is the guaranteed issue capabilities. As far as the no donut hole on the prescriptions, that's unbelievable. Now, instead of having smart sense, shopping around, trying to be living healthier, and by saying, well, I got $1,000 cap, Peter, I better really watch this budget or it's going to cost me. Now people will just say, well, I get unlimited prescriptions. Maybe I should try that one and this one and this one. How is that going to lower the costs? So that is a problem. So I'm with you on that. I'm with you on that.
Enforcement, excuse me, Mike, the enforcement on this is by the IRS. Have you ever heard of the IRS, and do you know the kind of thugs that they will be in this Gestapo?
It's the IRS is the direct link to the exchange. All right, there's like 4 other calls waiting. Ferris, talk to you next Wednesday. Gestapo, good word. No, so Peter, on the exchange, there's going to be a link from Access Health CT right to the IRS portal, and it'll find out if I'll pick on myself. I put my Social Security number in, my beautiful wife Diana, Lance, and Alexander. And then I'm a family of 4. What's my income, whether I qualify for a certain poverty level? Most importantly, and we're going to take a commercial break in a couple minutes, but most importantly, let Peter and I tell you, there is no open enrollment for this, people. Go ahead, Peter.
Yeah, well, what's going to happen here is there's just going to be a smooth transition from Anthem to Cigna come July 1st. You as a employee or as a retiree don't have to do anything. You are in a plan as a retiree, and you will continue to be in that plan. As I said earlier, that plan may have a different name, but it'll be the same set of benefits. And come July 1st, the only difference is you will have to produce the Cigna card and not the Anthem card, but you will not have to fill out any forms with respect to that.
Right.
With regard to employees, we do have open enrollment, but that's an annual thing.
Right.
We do that every year anyhow.
People.
Right, but that's unrelated to the switch and third-party administrators. That is just for employees. They have a right to open enrollment every year.
And they will be given a couple options of choices?
They will be given the options that are provided in their contract with the city. Typically, that is, for some, the PPO, the POS, or the POE. For some contracts, it's just the PPO and the POE.
Okay, so for those of you out there, Peter's been shooting these terms out. PPO, Preferred Provider Option. Preferred Provider Option. POS, Point of Service. So a PPO gives you a larger national network. Point of Service is a local Cigna plan, state of Connecticut and maybe some surrounding states, but it gives you an out-of-network component, meaning you choose to see a psychiatrist. This happens all the time. Psychiatrists say, I don't participate with Cigna, or I don't participate with Anthem. That's okay. You have an out-of-network component where you'll pay an upfront deductible. And then for the point of service, is the Cigna plan 80-20, 70-30, 90-10? What's the out-of-network component?
Ours is currently 70-30.
Okay, so on every $100, you are being on the hook for $30 of every $100. So 70-30 is the negotiated ratio of reimbursement.
Just let me clarify.
Certainly.
For active employees, it's 70-30. Retirees, depending on what plan they are on,
when they retire,
it may be 80-20.
Right. Yeah. So if you retired more than 12 years ago, some of the people in the room definitely did, you may have a different contract. And again, remember, they're matching apples to apples, same or better. Mayor said it 5 or 6 times, same or better than what you have. And just listening for 42 minutes to Peter, the prescription drug coverage is better. If you had a $1,000 cap, hard cap, and now that's gone, that does benefit a lot of people.
Oh, it does, but let's be clear that the cap was taken off because of Obamacare.
Healthcare reform.
Healthcare reform, yes.
Another person is becoming universal. All right. Commercial break. We'll be back in a few minutes, and I think we might wrap it up after that one.